Well, welcome. Thank you for tuning in again. It is Wednesday, the 1st of April already. And I know I'm speaking to quite a few people that are in stages of lockdown at the minute. We've been told to stay in our homes as much as possible to break the chains of transmission with just essential workers going out. And this is absolutely important because really the most important number at the moment in the world is 1. And it reflects the R0 number, this reproductive index number. Now, if the R0 is 1, that means each infected person, on average, infects 1 new case. If the R0 is 2, each infected person on average is infecting 2 people, and the numbers are going to grow. So what we need to do is get this R0 below 1, so that 1 infected person is, on average, infecting less than 1 new person, then the numbers will go down. So that's why many of us are locked down at the moment. So take R0 to less than 1 for the crisis to be done. That's what we are paying this huge price for, to get the R0 below 1. Then this crisis will be done. Now, I've had quite a few questions about these mass disinfectant programs you see going on. Trucks going down the street spraying disinfectant. And even people being sprayed. That was quite disturbing. I saw people being sprayed in India. That really shouldn't happen. Now, is this an effective strategy? Well, we need meticulous hygiene, and the virus can be killed by antiseptics and the virus can be killed by alcohol. But I think it's more important to be hygienic and to disinfect on a small surface. So disinfect the surfaces in your kitchen. Disinfect your potential fomites like your pens and your mobile phones. Keep your mobile phone nice and clean. Disinfect the steering wheel in your car or the handles or the door handles in your house, especially your front door. So I think disinfecting things on a small scale is a really good idea, as long as it's combined with the meticulous hand hygiene that we've stressed so often on this video. But as for this mass disinfectant, especially disinfecting the ground, I don't really see too much potential advantage for that. I'm certainly not aware of any evidence for it, and it seems to be putting one awful lot of chemicals into the environment, which isn't probably a good thing. So I think we need to be much more targeted is the answer to that one. Now, I'm getting so many questions about masks. Now, masks is a difficult one. For example, we'll see later today that Austria has just introduced mandatory mask wearing in supermarkets. Now, in hospitals, we wear masks normally to protect people from ourselves. So in theatre, for example, you wear a mask so I'm not breathing and coughing into the patient's open surgical wounds. So I think masks are good to keep my bugs in. But the masks aren't designed to keep bugs out unless they're very effective, tight-fitting, highly filtering masks. So mass use of masks is probably not that effective for protecting individuals. But if people are infected, it can stop them infecting other people round about them. So it's good from that point of view. And Hong Kong advise mass mask wearing, as indeed they did in China. So I'm not going to say that they're wrong. So infected people can keep their viruses in with masks, as long as they're fairly fresh. If they get moist, then the virus can just stick to the masks. And of course, it's very important how you take them off as well. So if you've got virus on a mask and you take it off and flap it all around the place, then that's going to spread viruses around the place. So it's very important how you take it off carefully, fold it over, fold the infected surfaces in, or if you're infected, fold the surfaces in, and then dispose of it hygienically. Now let's go on to some specific information for today. 873,000 people confirmed to be infected. We know it's way more than this. 43,000 confirmed deaths, and again, sadly, we know it's higher than that. 184,000 people recovered, which is great. Now I want to talk about, before we go on to news, in fact I might do the news as a separate video today. The World Health Organization has published data based on the 55,000 cases studied in China. And there's some very relevant data on this as regards the clinical features. Now, clinical features can be divided into signs and symptoms. A sign is something that I will see when I examine you. So if your lips are a bit blue or your lips are a bit pink, pink would be a good sign. That's a sign I'm observing about you. A symptom is something the patient reports. So if I have a headache, my examining doctor can't see that, so it's not a sign, so it's a symptom I am reporting, something I am experiencing. So these signs and symptoms are called clinical features. And these are patients that have been confirmed to have COVID-19 virus from large-scale studies in China of 55,000 people. And of course, as always, I will post the link for this. Now, of people that were infected with the virus, 88%, most of them, had fever. So virtually everyone, almost 9 out of 10 people who get this virus get a fever. So if you haven't got a fever, it means it's less likely you've got the virus. Only 12% of people who get the virus don't get a fever. The vast majority get a fever. Their body temperature goes high, as measured with a simple clinical thermometer. Now I've got this one here, which is this is my electronic one, which is quite nice. So you can measure the temperature in various places with this. So that says my forehead temperature is 35.5, which might not be too far out. Try my temple. 36.3. So that's a reasonable body temperature. So getting one of these for the home is a very good idea. Now the mercury thermometers or the electronic thermometers that go under the tongue or in the armpit are equally good, but these are just convenient, and these are actually quite cheap now. These used to be really expensive, but they're actually quite a good price now. And this is my personal one, so I do put it in my ear, so that can go and take the temperature in the ear. That's called the tympanic membrane pressure. Tympanic membrane temperature even. And we see mine's 35.9. But that was lower than my temple, so there's probably a bit of wax in my ear. I'll have to pay attention to that. So body temperature, very important. If there's a fever, let's say above 37.8 degrees centigrade would be a fever. Now, dry cough is a very common feature. Two sorts of coughs. Dry coughs do not produce sputum. You don't feel the sputum come up into your throat, whereas a productive cough you do. So dry cough is a common early feature. And undue fatigue is commonly reported as well. Now, this has been described as physical fatigue, in that the patients just feel they can't do anything apart from lie on a couch or go to bed. But it's also described as mental fatigue. The mind just feels exhausted and people just don't want to think about things. So fatigue, mental fatigue and physical fatigue, undue fatigue, feeling very tired. Now, this was new to me actually. Quite a few are coughing up sputum, up to 33% cough up sputum, so a productive cough. So most have a dry cough, but some have a productive cough. And the cough would become more productive as well as the illness is prolonged and the cilia start clearing up excess mucus in what's called the mucociliary clearance system, as these wafty hairs, these cilia, bring the mucus up so it can be coughed up. But 33% of the patients in China had or developed a productive cough. So typically we'd expect a dry cough earlier on than a productive cough later. Now, about just under 20%, 19% experience shortness of breath. Dyspnea, we call this in medical terms. So a feeling of shortness of breath, a subjective feeling of shortness of breath. Very unpleasant, but for most of the patients this was transitory and mild, because remember, 80% of patients get a very mild presentation of COVID-19 infection. Now, the Chinese study called it bone or joint pain. The people I've talked to with it, and other literature says more muscle pain. But what it really means is body aches. Now, if you've had this infection, you'll know what I mean. And if you've had influenza, you'll also know what I mean. Any bad viral infection, you just ache all over, just aches. And it can be achy up to the point where you describe it as a pain rather than an ache. So the whole body is achy and sore, and that's a classic feature of viral infection. Now, sore throat, again, this is more likely to develop as the illness goes on, but about 14% reported a sore throat. About 14% reported a headache. Because remember, this is basically a disease of the lower airways, and the upper airways are only affected typically later. There's always exceptions, of course. Some people can have sore throat initially. but only 14% from the Chinese data reported sore throat. Headache, 14%. Chills, now this was surprisingly low really. Chills is that sort of feeling cold, sometimes called a rigor, where your body's trying to warm yourself up, because remember, the immune system works best at pyrexial temperatures. When you have a fever, your immune system's working better than when your temperature's normal. So that chills to warm people up is part of your natural defences to try and warm you up. But only 11% of people reported that, so that's interesting. That is somewhat apparently inconsistent with that, because whenever I develop a fever, I feel cold and try and warm myself up. So chills there probably more refers to rigors, but 11% anyway reported it from the Chinese data. Now, nausea or vomiting was only 5%. So a relatively low number there with nausea or vomiting. Other studies have shown higher figures than this. And nausea has been a feature in a few people I've talked to as well. Stuffy nose developing, 5%. But there again, maybe 5% of the population have got a stuffy nose at the best of times. Diarrhea, only 4% in this study. Now, I've read other studies where the amount of diarrhea has been much higher than this, way higher than this. But this is what the data from China said. Whether Chinese people are reluctant to report diarrhea or not, I don't know. Because we know the virus can live in the gastrointestinal tract and cause diarrhea and vomiting. We call this hemoptysis, coughing up blood, only 1%. And swollen eyes were at 1% as well. Certainly if someone was coughing up blood, I'd like a doctor to see you and tell you why you're coughing up blood. It could just be the amount of coughing. But now, another feature that was present was low saturations, but not very short of breath. So remember, the oxygen saturations, you can only really tell those if you've got one of these devices. Now, this is a new one I've just got. I think it was only about £23. You can't really see it in this light, I don't think, but maybe you can see that. Let me move it up a bit. Almost see that. 96 saturations and 68 pulse. It's just a bit faint. This one's a bit brighter. Let's try this one. See what my oxygen saturations are. So my oxygen saturations are 98% and my heart rate is 72. So the oxygen saturations is the proportion of the hemoglobin in my blood that is saturated with oxygen. So we see that only 1% or 2% of my hemoglobin is not carrying oxygen. It's quite amazing how efficient the lungs are. Now, and so, but what we'll be sometimes getting in these patients is they're not feeling short of breath, but they can develop low oxygen saturations. So low oxygen saturations in the absence of shortness of breath, interesting feature. Not really what you would normally expect. Now, this was not in the Chinese data, and I first heard about this from data from, it was actually emails from Iran maybe a couple of months ago. This loss of smell and taste, but this has been confirmed by the ENT specialists in my country. And what they're saying is a third to 2/3, that's 33 to 66% of younger people presenting with features of the virus will lose the lost sense of smell and taste. Now, taste is largely dependent on smell, but both do seem to be lost, with limited other features. In fact, sometimes in young people, this has been the only clinical feature, that they lose the ability to smell and lose the ability to taste or have reduced taste. So this is important because, as we mentioned on a previous video, we need to have a high index of suspicion for these people, because if these people lose the sense of smell, and that is the only clinical feature we've got in the absence of the widespread testing that we currently don't have, then that should be an indication for isolating them. So if a young person says, I just can't smell anything anymore. Yesterday I was smelling fine. Today I can't smell. We should have a high index of suspicion. Think, that could be COVID-19. So we better isolate them, so they're not spreading it to other members of the family or other people around about them. Surprising that didn't come up in the Chinese data, but this is now getting fairly well established. And that was from this. So that was the first Chinese study of over 50,000 people. Now this is another Chinese study of over 70,000, just published in the Lancet, and this is the link to that study I'll post. So we're finished thinking about clinical features now. We're on to thinking about complications. Now, this was quite an involved paper. I haven't had time to read it all in detail, but this is on 55,000. I think it was 55,000 patients. No, this was 75. Sorry, the first study, the one on the clinical features was 50 or 55,000. This one's on 70,000 people. So this is on 70,000 people studied in China. Now, the overall case fatality rate was found to be 1.38%. Now, I'm hopeful that it's lower than that. When this epidemic's finished, I'm hopeful we'll find it's lower than that, because there's a lot of people in China who would be infected but were not diagnosed. So if 10 times more people were infected than were diagnosed, that means the death rate would be a tenth of that. And what we're still thinking is the death rate is going to turn out to be around about 1% overall, is what we're thinking. And the Chinese data confirmed in this new study just reanalyzed in the Lancet, just published on the 30th of March, that the case fatality rate, the number of people that died per 100 people infected, rose sharply with age. And the case fatality rate in under 10s was 0.0016%. So that's remarkably good news. So that's like 2 in 100,000, isn't it? I mean, it's still tragic, but it's a relatively low figure. I think just under 2 in 100,000 of under 10s died from this condition. Whereas the case fatality rate in the over 80s was 7.8%. So 0.0016% of those under 10 died, 7.8% of those 80 and above. And indeed, other studies have shown it to be even higher. And yesterday morning, I think it was, we posted a study based on that care facility in Washington State, in King County, which was showing, I think it was about 24% case fatality rate in people that were old and with comorbidities as well. So older people with comorbidities, the number you would expect to be higher than 7.8. Older people without the comorbidities, you would expect that number to be lower than 7.8. And this is not too inconsistent with the Imperial College London figure of 0.03% of case fatality for those under 30. So of people under the age of 30 that get this infection, for every 10,000 people that get the infection, Imperial College predict that 3 of those 10,000 will die from it. So way, way lower, again, higher than those under 10. It's quite amazing that there seems to be this almost linear relationship in increasing deaths, although it does increase quite dramatically over the age of 70. But we'll see here as well. 10 to 19-year-olds, again, this is from this Chinese data of 70,000 people. 10 to 19-year-olds, hospital admission was 0.04%. So that's 4 in 10,000, isn't it? So 10 to 19-year-olds, 0.04% were hospitalised. But with 40 to 50-year-olds, that went up from 4 in 10,000 to 4 in 100. 4%. 40 to 50-year-olds. So of all the 40 to 50-year-olds that caught the COVID-19 infection, 4% required hospitalisation. In the 50 to 60-year-olds, that went up to 8% required hospitalisation in China. And I haven't included in this, but there was more men than women in that sample. Whereas in China, in the over 80s, the hospital admissions went up to 18%. And the case fatality, as we've already noted, was 7.8%. So I might unpick that study a bit further as soon as there's some time, but I thought that was some interesting data there. So I think I'll come back and do the news as a separate video. I'll leave you to think about that one for now. Then we'll come back and look at what's going on in various places around the world today, the 1st of April.